club and the vehicle by which we'll kill it is this bill, and that's why I'm going to vote for it, and I urge all of my colleagues to do the same.
Yields back. Gentleman, Mr. Levin from Michigan is recognized.
It's now my privilege to yield 3 minutes to the distinguished gentleman, Mr. Clay.
Gentleman is recognized.
Thank you, Madam Speaker. I thank the gentleman from Michigan for yielding. Madam Speaker, my friends on the other side of the aisle want to repeal the Affordable Care Act. Since straight-out repeal didn't work, they are trying to dismantle it bit by bit. I'd like to focus on the effects of the ACA, or the Affordable Care Act, on women's health. The ACA is the greatest improvement for women's health in decades. The health care needs of women are greater. Historically, women have played a central role in coordinating health care for family members. Here are just some of the ways that the ACA, a bill that I am proud to have helped pass, will improve women's health. Women will not have to pay more than men for the same insurance policy. Imagine that. Women will not be denied coverage because they are sick or have pre-existing conditions. Oh, that's an improvement. Women will be guaranteed preventive services with no deductibles or co-pays. More low-income women will have timely access to family planning services. Wow, miracles of miracles. Nursing mothers will have the right to a reasonable break time and a place to express breast milk at work. Pregnant and parenting women on Medicaid will get access to needed services. That would be an improvement. Senior women will save thousands of dollars as reform closes the Medicare prescription drug coverage gap, and women will be able to comparison shop when choosing health plans for their families. Family caregivers, who are typically women, will benefit from new supports that help them care for their loved ones while also taking care of themselves. Madam Speaker, as a son, as a father, as an American, I strongly support the ACA and its improvements to health care for everyone, especially women. And I yield back the balance of my time.
Gentleman from Michigan, Mr. Camp.
I yield 2.5 minutes to a distinguished member of the Ways and Means Committee, the gentleman from Washington State, Mr. Reichert.
Gentleman from Washington is recognized.
Thank you, Madam Chair. You know, 2 years ago, the President's massive health care plan came before us, and then Speaker Pelosi said, we had to pass this bill to find out what's in it. Well, you know what? We're finding out what's in this bill. In the last 2 years, we've had 47 committee hearings. We've had in 6 different committees. We've taken 25 floor votes to repeal, defund, or dismantle harmful elements of this massive $1 trillion, 2,000-page government takeover of our nation's health care system. We're finding out what's in this bill. We've already repealed the 1099 requirement with bipartisan support. We've already repealed the Class Act with bipartisan support. Now we're awaiting the Supreme Court's decision on whether the individual mandate is constitutional. And I think the public is now beginning to learn a little bit about this bill themselves. I think they know there's a 3.8% tax on small businesses, our job creators. There's another 2.3% tax on medical devices, wheelchairs, for our seniors, hearing aids, for our disabled folks. These are things that are in this bill. There's a 40% tax on your health care plans. And now they keep telling us, too, that if you like your health care plan, you can keep it. Well, President Obama himself said, you know, there may have been some language snuck into this bill that runs contrary to that premise. Who do we believe here? What do we believe? And here we are again. One more thing to add to the list of what we're finding out. IPAB, the Independent Payment Advisory Board. This unelected board makes decisions and gives recommendations to Congress for cutting Medicare payments. So this panel of unelected bureaucrats unilaterally decides what kind of care is now available and allowable to our seniors, to our veterans, and to our Americans with disabilities. Not doctors, not nurses, not anybody with medical or scientific training. These are bureaucrats. It's just what we need, more bureaucrats. If we don't vote to repeal this provision, a gang of 15 unelected bureaucrats will have the ability to cease or to cause cuts to Medicare payments without anyone else's input.
I yield the gentleman an additional 30 seconds.
Gentleman has additional 30 seconds.
Thank you. So this rationing board will threaten seniors' access to care in secret. There is absolutely no requirement for openness or transparency or for those bureaucrats to hold public meetings or consider input on its proposals. The IPAB, this board of bureaucrats, is unaccountable, it's secretive, and threatens patients' care. I yield back.
Gentleman yields back. Gentleman from Michigan, Mr. Levin.
We're talking about a board whose operation is triggered, according to CBO, 10 years from now. And I just want to say those who say it's unaccountable, every one of their recommendations will come before the Congress of the United States. Every single one. What's unaccountable are the statements that are made on this floor that are not true. I reserve the balance of my time.
I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentleman from Texas, Mr. Brady.
Thank you, Madam Speaker. Thank you, Chairman Camp. Many members of Congress didn't have the time or the choice to read this new health care law before it became law. After it's passed, I asked our economists, the Joint Economic Committee, they spent 4 months going through every page and provision of this new law to show the American public just what this new health care takeover looked like. They went through all 2,300 pages of the bill, and this is what the new health care law in America looks like. Well, actually not completely. We can only fit 1/3 of all that new bureaucracy on one page. Here are the physicians. Over in that corner are the patients. And in between are 159 new federal agencies and bureaucrats in between you and your doctor. We can do better for the American public than this horrible health care law. And we're doing that today. Today we're going to take on this chart. The way it works, everything in dark blue is a new expansion of government. Everything in orange, potential rationing boards. Everything in green is $1 trillion of new tax increases or slashing cuts to Medicare. All the light blue provisions deal with expansion of government into the free market. But today we're going to act. We're not going to wait. We're going to act to repeal one of the key rationing boards. This Independent Payment Advisory Board, you've heard today, 15 unelected bureaucrats who make life or death decisions about treatment in the future. My mom is one of those Medicare seniors who I have no doubt, if this is not repealed, will someday see her treatments limited by these unelected bureaucrats. Our Democrat friends say we're not rationing because the government will not actually say no to a senior who needs care. They just won't reimburse the doctor or the local hospital or the local hospice care to take care of them. I don't know what you call that, but I call that rationing. And this board has unlimited power.
30 seconds.
Thank you, Mr. Chairman. I'll be very brief. It has unlimited power to slash even more than that, and Congress is virtually powerless to stop it. This is America. We don't allow these bureaucrats to make these life or death decisions. Republicans in this House are going to repeal this dangerous bureaucracy. And we are, when we get a chance, replacing it with affordable health care for America. I yield back.
And Mr. Levin.
Now, what the Republicans would do would be to send the decisions already there in large measure to insurance companies. I reserve the balance of my time.
All right.
Gentleman from Michigan, Mr. Camp is recognized.
Thank you. I yield 2 minutes to a distinguished gentleman from Pennsylvania, Mr. Dent.
Gentleman from Pennsylvania is recognized.
Thank you, Madam Chairman. The bill we're considering today, H.R. 5, the Preserving Access to Health Care Act, or PATH, is about patient access to care, plain and simple. In the months leading up to the passage of the health care law, and since the law was enacted, Congress has spent countless hours talking about the need to increase access to health care. The health care law signed nearly 2 years ago was the wrong direction for our country and for our citizens, and will negatively impact access to care. The two issues that we're going to address here today in this legislation, repealing the Independent Payment Advisory Board, or IPAB, and enacting meaningful medical liability reforms. These are key to ensuring that all Americans have access to quality of care. Now, the first piece of this legislation, the IPAB, the Independent Payment Advisory Board, let's be very clear. Nothing about these advisory rulings are advisory. Good luck to anybody. Good luck if you try to ignore the advice of the IPAB. It's going to be more like the medical IRS than an advisory panel. And let's be very clear about the purpose of this IPAB, is to save money by restricting access to health care for Medicare beneficiaries. It will achieve these savings by ratcheting down payments to providers who are already underpaid by Medicare. This will lead to fewer doctors who are willing to see Medicare beneficiaries, and undeniably, this will lead to delays and denials of care. This board, as has been said many times, is made up of 15 unelected bureaucrats and unaccountable ones at that. They'll wield enormous power, and there are no checks and balances in place to ensure the authority is being used appropriately. This abdicates Congress's responsibilities, and it threatens care for our nation's seniors. Make no mistake that IPAB must be repealed. We don't need a medical IRS. The second part of this legislation is going to reform the medical liability system. Across our country, our medical profession has practiced defensive medicine out of fear of frivolous lawsuits. And this not only drives up health care costs, but it creates serious doctor recruitment and retention problems, especially in the so-called high-risk disciplines such as orthopedics, neurosurgery, emergency medicine, and obstetrics.
I yield the gentleman an additional 15 seconds.
Additional 15 seconds, gentleman from Pennsylvania.
This medical liability crisis has had serious implications in my state of Pennsylvania. It's time we act on this issue. I live in a state where we train a lot of doctors, but we can't retrain them, we can't retain them, we can't recruit them. It's a very serious problem for us. It's time we pass this legislation. We'll say more about medical liability tomorrow in the amendment process. Support the legislation. I yield back.
Gentleman yields back. Gentleman reserves his time. Gentleman from Michigan, Mr. Camp.
I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentleman from Louisiana, Dr. Bustani.
Gentleman from Louisiana is recognized.
Thank you, Madam Chairman, and I thank the chairman of the full committee for yielding time to me. I had a great career as a cardiac surgeon, treating thousands of Medicare patients in my career. And my career ended prematurely because of a disability. But I learned something a long time ago from my father, who was a family doctor who went before me, who taught me about the art of medicine. And the most important thing he taught me, despite all the technology we have, is that trust in the doctor-patient relationship is the most important thing, the most important foundation of good health care, high-quality health care. Look at this chart. What's wrong with this? Clearly, you can see all the bureaucratic entities, but where's the doctor and where's the patient? Well, the doctor's down here in the corner, and I think way off in the other corner are the patients. And so all this stuff in the middle is what undermines the trust in the doctor-patient relationship. Now, we had Health and Human Services Secretary Kathleen Sebelius in front of our committee recently, and we were asking about this Independent Payment Advisory Board, and we asked the question about rationing. And what came out was, number one, there's no definition of rationing in the statute, so the department will have to write rules. And she admitted in committee, very tacitly, but effectively admitted, that they're not going to be able to write rules that can actually protect seniors from IPAB. Even the left-leaning Kaiser Family Foundation admits IPAB must issue cuts to meet spending targets that, I quote, even if evidence of access or quality concerns surfaced. AARP warns IPAB's Medicare cuts could, I quote, could have a negative impact on access to care. Both of those are really understatements. According to Medicare's own actuaries, Medicare physician payments could fall to less than half of projected Medicaid rates under current law. We won't control costs by cutting Medicare provider reimbursements below cost of providing care, and if left on the books, IPAB will endanger the lives of seniors and delay access to providers. It's very clear. This undermines the doctor-patient relationship. It undermines trust in our health care system. It undermines quality, and we will not control costs with IPAB. That's why we must repeal it. I yield back.
Gentleman yields back. Gentleman from Michigan, Mr. Levin, is recognized.
I yield myself 1 minute.
Gentleman is recognized.
You know, the present system doesn't have enough primary care. I know from my own experience that there's a lack of family physicians and primary care physicians. The Affordable Care Act strengthens that program, will strengthen the relationship between the physician and the patient. And for anybody to come here and scare patients and seniors into thinking that there is some kind of a wall that will be placed is really not true. Yes.
We have a severe shortage of physicians in this country today, and it's getting worse. Worse by the month and by the year. And as a physician who stays close to the physician community around this country, I'm hearing all kinds of stories about physicians nearing retirement or moving up that retirement date. We're seeing fewer people going to medical school. All of this is creating a major disruption in our health care system.
And I yield myself an additional 1 minute.
Gentleman.
Look, I respect that, but the primary fact, the basic fact is that the Accountable Care Act addresses this issue more effectively than has been addressed before. There is more money for primary care physicians, for family physicians. That's what we need. That's what we need. And to come here and raise the specter that this bill is going to diminish it when its major purpose, among others, is to increase the availability, to have a linkage between the patient and the specialty care.
If the gentleman would yield for one more point.
Go ahead.
We have a severe shortage in cardiothoracic surgeons, in neurosurgeons, other key specialists that are very essential for the care of Medicare patients, and it's getting worse. We need both primary care and specialty physicians to deal with this patient population. It's getting worse. I
yield myself an additional 30 seconds. Look, we need to address it, but destroying Medicare is not the way to address it. That's what you do. You destroy it. You destroy it when you say you're saving it. I reserve the balance of my time.
This gentleman from Michigan, Mr. Camp.
I yield 2 minutes to the distinguished gentleman from Indiana, Mr. Pence.
Gentleman is recognized.
I thank the chairman for yielding and ask unanimous consent to revise and extend my remarks.
Without reservation.
Thank you, Madam Chairman.
Without objection.
I rise today in support of the Protecting Access to Health Care Act. This bill will take an important step forward in dismantling the government takeover of health care that was passed by this body some 2 years ago. The PATH Act essentially would repeal the Independent Payment Advisory Board included in Obamacare, and I strongly support it. Now, quite frankly, the IPAB, that is the acronym that's been used often on the floor in this debate, is probably something that most Americans are unfamiliar with. But they deserve to know that buried in Section 3403 of Obamacare, there's a powerful board of unelected bureaucrats, this so-called Independent Payment Advisory Board, whose sole job will be to save money by restricting access to health care for Medicare beneficiaries. That's the purpose of IPAB. IPAB is required to achieve specific savings in years where Medicare spending is deemed to be too high. It will lead inexorably to rationing. It'll take medical decisions out of the hands of doctors and patients, and it will reduce patient choice, unambiguously. Furthermore, Obamacare doesn't even require that IPAB do all of this in the public domain. There's no requirement that IPAB hold public meetings or hearings, consider public input on its proposal, or make its deliberations open and to the public. Unaccountable Washington bureaucrats meeting behind closed doors to make unilateral decisions that should be made by patients and doctors is unacceptable, and this IPAB must be repealed. You know, it was 2 years ago that we passed this government takeover of health care into law. It's important to note that the first act in this Congress in January 2011 was a full repeal of Obamacare. You'll never convince me that the federal government—
I yield the gentleman an additional 30 seconds.
I thank the gentleman. You'll never convince me that the federal government under the Constitution has the authority to order the American people to buy health insurance whether they want it or need it or not. My hope is that in the days ahead the Supreme Court will come to that conclusion. I believe we must not rest, we must not relent until we repeal Obamacare lock, stock, and barrel. But for now, let's take the path that is before us. Let's pass the Protect Access to Health Care Act, and let's repeal this onerous Independent Payment Advisory Board once and for all. And I yield back.
Gentleman yields back.
You ready to close? I yield myself the balance of it.
Gentleman from Michigan, Mr. Levin is recognized.
Look, the Supreme Court will be hearing the case about the individual mandate next week, and I don't think we want to argue this now. We don't have any judges here. But let me say, on the individual mandate, it really is ironical that the more conservative apparently you are, the more you dislike the individual mandate. When the individual mandate was the central point within the health care reform proposal of conservatives in this country several decades ago. It was their central point in the 80s and in the 90s. And now they've reversed course and claim, I guess, what they proposed in the 70s and 80s was constitutional then, is unconstitutional today. Talk about a flip-flop. That is, I think, maybe an unconstitutional flip-flop. But the court will decide that. Let me just say a word about cost containment and the importance of our addressing that and the importance of our reforming the present system, how we reimburse the fee-for-service system. And I don't think it's been noticed. In addition to IPAB, ACA has a number of provisions that will go into effect long before IPAB could become operational. And those systems are beginning to work. And for conservatives who talk about the importance of cost containment, they want to repeal an act that has within it not only the seeds of cost containment, but the instrumentalities of it. And in fact, they're beginning to work well enough. That's why CBO says that it's going to be 10 years before IPAB is triggered. And so those who come here who claim to be concerned about cost containment essentially are undermining their own position. Well, this is Act 1 of the Republican 3-act play. The second is to eliminate health care reform altogether, and the third is to take away Medicare. And I want to close reporting the views of AARP. in terms of the Ryan budget proposal. It says, and I quote, "It lacks balance, jeopardizes the health and economic security of older Americans," end of quote. Quoting again, "A number of proposals in this budget put at risk millions of individuals by prioritizing budget caps and cuts over the impact on people," end of quote. And those who talk about the cap that would essentially be within the structure of IPAB's operation, that proposed cut is less than in the Ryan budget, which would be more severe. And essentially, the implementation would be by insurance companies who are nameless, who are unaccountable. So let me continue with another quote from the AARP. "By creating a premium support system for Medicare beneficiaries, the proposal is likely to simply increase costs for beneficiaries while removing Medicare's promise of secure health coverage, a guarantee the future seniors have contributed to through a lifetime of hard work." And then they finish. "The premium support method described in the proposal, unlike private plan options that currently exist in Medicare, would likely price out traditional Medicare as a viable option, thus rendering the choice of traditional Medicare as a false promise." Thus rendering the choice of traditional Medicare as a false promise. So this is what I think we should do in terms of this three-act play of the House Republicans. And that is to start by rejecting Act 1, this repeal of IPAB. This may be a vote, but it's not going to be an act. I finish with this. In a sense, you are acting, because this isn't going to become law. You have not come up in all of these months with a comprehensive alternative to the Accountable Care Act. There's not been a comprehensive bill put forth. We haven't voted on a comprehensive bill in these days on the Ways and Means Committee. Instead, there has been a piece-by-piece effort to dismantle what was health care reform to address a serious situation, including over 50 million people who go to sleep every night without health care coverage in the United States of America. We should be ashamed of that. We should be ashamed. And a couple years ago, we acted to lift that shame off of the shoulders of all of us in the United States of America. I urge we vote no on this bill.
Gentleman yields back the balance of his time. Gentleman from Michigan, Mr. Camp, is recognized.
I yield myself the balance of my time.
Gentleman is recognized.
Nearly 70% of seniors are worried that IPAB will limit their Medicare choices and the coverage that's available to them under Medicare. And I think this is the most troubling part of the health care law that the Democrats rammed through the Congress, and that is because this secret rationing board is given enormous power with no accountability. The IPAB allows the 15 unelected board members of IPAB are free to cut reimbursement rates for certain procedures or for services that they deem unnecessary. And they can cut those rates so low that physicians will no longer be able to offer those services. That's pretty clearly the ability to ration. we've had countless physician groups warn us about the IPAB. They're warning us that these cuts will force them to stop seeing Medicare patients. And the real problem is because TRICARE reimbursement rates are tied directly to Medicare, that we'll have health care for our military personnel negatively impacted by the IPAB as well. The Democrats gave IPAB blanket authority to operate in secret. There's no requirement that their deliberations, their reasonings for their conclusions must be made public. And also, the health care bill states directly that IPAB, and I'm quoting here, may accept, use, and dispose of gifts or donations of services or property. That's not a very subtle invitation for lobbyists and others with interests in issues before the Congress to impact these unelected and unaccountable IPAB members with cash, with gifts, with other items. So not only do they have enormous power that if the Congress can't override, automatically becomes law, but they have the ability to do it in secret, and the legislation states directly that they can accept gifts and donations. So this is a troubling piece of Obamacare that we need to repeal, and I urge my members to vote for repeal of this, and I yield back the balance of my time.
Gentleman yields back the balance of his time. A lot of Michigan guys. Does the gentleman from Texas seek to be recognized?
Yes. Madam Chairwoman, I yield myself such time as I may consume.
Gentleman is recognized.
Madam Chairwoman, America's medical liability system is broken and in desperate need of reform. Frivolous lawsuits drive physicians out of the practice of medicine. Limitless liability discourages others from high-risk medical specialties and substantially increases the cost of health care. The solutions to this crisis are both well-known and time-tested, but the President's recent health care legislation did nothing to address the problems in our medical liability system. We cannot wait any longer to fix the problem. We should pass this bipartisan medical liability reform legislation to cut health care costs, spur medical investment, create jobs, and increase access to health care for all Americans. H.R. 5, the Health Act, is modeled after California's decades-old and highly successful health care litigation reforms. According to the National Association of Insurance Commissioners, the rate of increase in medical professional liability premiums in California since 1976 has been nearly 3 times lower than the rate of increase experienced in other states. By incorporating California's time-tested reforms at the federal level, the Health Act saves taxpayers billions of dollars, encourages health care providers to maintain their practices, and reduces health care costs for patients. It especially helps traditionally underserved rural and inner-city communities and women who seek obstetrics care. The reforms in H.R. 5 include a $250,000 cap on non-economic damages and limits on the contingency fees lawyers can charge. It allows courts to require periodic payments for future damages in order to ensure that injured patients receive all of the damages they are awarded without bankrupting the defendant. The Health Act also includes provisions that create a fair share rule by which damages are allocated fairly in direct proportion to fault. And it provides reasonable guidelines on the award of punitive damages. The Health Act allows for the payment of 100% of plaintiffs' economic losses. These unlimited economic damages include all their medical costs, their lost wages, their future lost wages, rehabilitation costs, and any other economic out-of-pocket loss suffered as a result of a health care injury. The Health Act also does not preempt any state law that otherwise caps damages. This bill is a common sense and constitutional approach to reducing the cost of health care. Whereas the Health Act allows doctors to freely practice nationwide, the Obamacare individual mandate dictates that all people buy a particular product whether they want it or not. Unlike Obamacare, the Health Act saves American taxpayers money. The Congressional Budget Office recently determined that the President's health care law will cost almost double its original $900 billion price tag. Another CBO report estimates that premiums for medical malpractice insurance ultimately would be an average of 25 to 30% below what they would be under current law. These are just a few reasons why organizations like Americans for Tax Reform support this legislation. The Health Act also reduces the cost of health care as it decreases the waste in our system caused by defensive medicine. This practice occurs when doctors are forced by the threat of lawsuits to conduct tests and prescribe drugs that are not medically required. According to a Harvard University study, 40% of medical malpractice lawsuits filed in the United States lack evidence of medical error or any actual patient injury. 40%. Many of these suits amount to legalized extortion of doctors and hospitals. But because there are so many lawsuits, doctors are forced to conduct medical tests simply to avoid a lawsuit in which lawyers claim that, quote, not everything possible was done for the patient. This wasteful defensive medicine adds to our health care cost without improving the quality of patient care. In his 2011 State of the Union address, President Obama said, quote, I'm willing to look at other ideas to bring down costs, including one that Republicans suggested last year, medical malpractice reform to rein in frivolous lawsuits, end quote. Let's help the President keep his word and put this legislation on his desk. And Madam Chairwoman, I'll reserve the balance of my time.
Gentleman reserves. Gentleman from Michigan, Mr. Conyers, recognized.
Thank you, Madam Speaker. Ladies and gentlemen of the House, when we passed the landmark Affordable Care Act, some who derisively term it the Obamacare, I believe that someday this bill will be famous because it's named after a president. We were proud to have taken up a step, an important step, in realizing a goal that we've been striving for quite a long time. But today, we're confronted with a leader in the House, himself a medical doctor, who is urging that we take a step backward and roll back our progress. The measure before us will repeal the Independent Payment Advisory Board, which would save us millions of dollars and pay for itself by pushing through malpractice legislation that undermines state sovereignty and enriches corporations that surely don't need it. Now, Congress established the advisory board to slow Medicare's growth costs. The Independent Payment Advisory Board does not undermine our role in Medicare policy, nor does it cut access to care. Its repeal, however, removes critical oversight and efficiency and paves the way for the majority's plans to replace guaranteed health care for seniors with corporate voucher systems. How many of us have constituencies that you could go back home to and tell your constituents that you're going to replace this health care bill that is praised from one end of the country to the other, that has taken decades to enact, that we're now going to use vouchers for health care? Please. I am going to, at this point, reserve my time, Madam Speaker.
Gentleman reserves his time. Gentleman from Texas is recognized.
Madam Chairwoman, I'll yield such time as he may consume to the gentleman from California, Mr. Lundgren, who is the chairman of the House Administration Committee and a senior member of the Judiciary Committee.
Gentleman from California is recognized.
I thank the gentleman for yielding. The idea that 15 unelected individuals on the Independent Payment Advisory Board have been empowered by the so-called Patient Protection Affordable Care Act to ration health care for seniors, and that's for all seniors, is as Orwellian as these titles crafted by the previous Congress to divert attention from what's really being done here. Delegating such authority to a government board to make decisions with such a dramatic impact on the health care alternatives available to Medicare recipients raises the most serious ethical concerns about respect for the dignity of our seniors. This is the unfortunate consequence of a worldview which favors the notion of bureaucratic expertise and efficiency as a solution to the challenges facing our health care system today. The purpose of providing quality health care to our nation's seniors is simply incompatible with the idea that the delivery of health care services can be achieved through some sort of algorithms contrived by a panel of experts. Rather than empowering seniors to play a more active role in their own health care decisions, the IPAB moves in the opposite direction by empowering an unaccountable government panel to make these decisions. In this regard, the inclusion of legislative language to repeal IPAB could not be better placed than with a medical liability reform bill, for IPAB is itself per se malpractice. Now, H.R. 5 contains many important reforms concerning our health care litigation system. These health care reforms are modeled after my own state of California's Medical Injury Compensation Reform Act, better known as MICRA. This important initiative was signed into law over 3 decades ago by then and now, again, California Governor Jerry Brown. Now, I practiced under this law for several years. I practiced under the law that preceded MICRA. I did a good deal of medical malpractice defense in the courtroom. I appeared before juries, before judges. I settled cases. I had the opportunity to defend doctors and hospitals. About 90% of the cases I did were on the defense side, about 10% on the plaintiff's side. I believe I had the first successful medical malpractice suit against an HMO in the state of California. I had an opportunity to view the system close up. And the fact of the matter is, without the MICRA reforms, the California medical system, the health care system, would have collapsed. We had doctors leaving the state of California, particularly in specialties such as obstetrics and gynecology, neurosurgery, anesthesiology, moving to other states because the premiums that were being required to be paid by our doctors had become so exorbitant that they either had to leave the state or no longer be able to practice medicine. Information received by our Judiciary Committee from the National Association of State Insurance Commissioners indicates that since 1976, when it was adopted, California's medical professional liability premiums have risen at less than half the pace of the rest of the country. While I would caution that MICRA must not be perceived as a silver bullet, it is nonetheless an important step forward taken by our state and a sound model for reform. This is once again evidence that as laboratories of democracy, our states more often than not serve as incubators of reform. At the same time, I do believe that it is important to recognize that the American legal system and our civil justice system in particular contains vagaries unique to each of the states which operate within the context of a system of federalism. In this regard, we need to be cautious on the federal level of making assumptions about the impact of our actions. Even in California itself, the effort to adopt a federal medical liability reform statute has raised some questions about possible unintended consequences. Even though one aspect of the impetus behind H.R. 5 is to bring relief to medical practitioners from the trap of defensive medicine, as suggested by the chairman of our committee, and I do believe that is true, physicians are unfortunately expressing some concerns over some of the provisions contained in H.R. 5. Specifically, the California Medical Association, while they support getting rid of the board, as we previously discussed, have expressed some opposition to the fair share rule contained in Section 4D of the Health Act. They've expressed that the fair share rule in H.R. 4 will preempt California's law and put full recovery by injured patients at risk. They inform us that as written, the fair share rule will dramatically increase the potential for physicians to face enforcement proceedings against their personal assets, and this will force physicians to purchase increased medical professional liability insurance coverage, which will significantly increase liability premiums in California for physicians. Secondly, the California Medical Association has expressed serious concerns with granting complete immunity from punitive damages to medical product and device manufacturers, distributors, and suppliers. They worry that this will force plaintiffs to look only to physicians and other providers to seek relief and will significantly increase physician exposure and liability costs. So I'm somewhat on the horns of a dilemma here. I do believe that we absolutely, as the physicians of the California Medical Association believe, ought to rid ourselves of the Independent Payment Advisory Board for fear that its implementation will, in fact, interfere with the doctor-patient relationship, interfere with the availability of medical care, interfere with the availability of physicians to seniors and others. But they have expressed some concerns about the attempt that we have to give other states the benefit of MICRA. And I understand some of their concerns. I think we may be very well able to address that in further language. So it is my intention to vote for passive H.R. 5, but my hope that before it would return to us from the Senate, we would specifically address the concerns raised by the physicians from my state. The necessary repeal of IPAB is an important reform. Some of these others contained in the further section of the Health Care Act warrant support, but I do believe we need to have some changes, and I would look forward to those changes in a conference report or any bill which is returned to the body by the Senate. I would like to say this, that for someone who practiced law for a number of years in the area of medical malpractice with doctors and hospitals and saw what a failure to limit non-economic damages was doing to the availability of health care, not just the cost of health care, but the availability of health care in my home state, I do believe MICRA is a model that ought to be replicated by other states in the Union. I do believe the facts are in. Over 30 years, we've been able to see that it has improved access to health care, improved the number of physicians, particularly in difficult specialties, and it has brought down the overall cost of premiums and therefore the cost of medical care in my state. The idea that somehow medical malpractice premiums have no effect either on the cost of care or the accessibility of care flies in the face of the experience of 30 years in my home state of California. And with that, Madam Speaker, I would yield back.
Gentleman yields back. Balance of time. Gentleman from Michigan, Mr. Conyers.
Madam Speaker, I am pleased now to recognize the former Speaker of the House of Representatives, our leader, Nancy Pelosi, for 1 minute.
The gentlelady is recognized.
Thank you, Madam Speaker. I thank the gentleman for yielding. I appreciate his leadership on helping us honor what our founders put forth in our founding documents, which is life, liberty, and the pursuit of happiness. And that is exactly what the Affordable Care Act helps to guarantee. A healthier life, the liberty to pursue happiness, free of the constraints that lack of health care might provide to a family. If you want to be a photographer, a writer, an artist, a musician, you can do so. If you want to start a business, if you want to change jobs under the Affordable Care Act, you have that ability, that liberty to pursue your happiness. And so that is why I'm so pleased that this week we can celebrate the 2-year anniversary of the Affordable Care Act. And I want to mention some of the provisions that are in it, but not before mentioning that the legislation on the floor today is a feeble attempt to unravel legislation that makes a big difference in the lives of America's families. You be the judge. If you are a family with a child with asthma, diabetes, is bipolar, has a pre-existing medical condition, up until this bill, your child could be discriminated against for life of ever receiving affordable health insurance and therefore care. But already, even though the full thrust of the law does not take place until 2014, right away, for months now, no child in America can be denied health coverage because of a pre-existing condition, and soon all Americans will have that same protection. For the first time in American history, millions of American women and seniors have access to free preventive health services, services that prevent, that are early intervention to detect a possible illness in a person. 86 million Americans have already received key preventive health benefits under the law. And more than 5 million seniors have saved over $3.2 billion in prescription drug expenses. Already, $3.2 billion in prescription drug benefits because of provisions of the law that are already in effect. So if you're a senior and you're caught in the donut hole, or you would have been, you have already and are already benefiting from this law. And that's what the Republicans are trying to take away from you, from your family, from your life, from your liberty, from your pursuit of happiness. The last point about seniors and prescription drug is particularly important because it fits in with our consistent commitment from day one as authors of Medicare in the 60s. It fits with our consistent commitment to always strengthen Medicare for American seniors, never weaken it. Indeed, as I mentioned, Democrats created Medicare, sustained Medicare, and Democrats will always protect Medicare, even from language that is so misleading as to make one wonder. Republicans, on the other hand, have voted to end Medicare guarantee. They have said that their goal for Medicare is for it to wither on the vine. And tonight's legislation is a part of the withering on the vine. It's important for you to know that if you care about Medicare, if you depend on Medicare. This is the wither on the vine scenario. And just in fact, yesterday, Republicans released their budget, which would end Medicare guarantee, shift costs to seniors. End the guarantee. What does that mean? Shift cost to seniors, perhaps up to $6,400 for most seniors a year, and again, let Medicare wither on the vine. That's why today's legislation is such a cynical political ploy, and I know that America's seniors will not be fooled by it. Today, Republicans have brought to the floor legislation that is known as IPAB, to repeal what is known as IPAB. Independent Payment Advisory Board. Independent of political influence over decisions that are made. This piece of the legislation was a bend the curve to reduce the cost of health care in America. Republicans are desperate to distract seniors from their real record on Medicare, and that's what they're trying to do today. I say that without any fear of contradiction, without any hesitation, because nothing less is at stake than the well-being of our seniors, their health, their personal health, their economic health, and that means their security. Further in this bill, Republicans have recycled their old medical malpractice liability legislation that undermines states' rights and hurts the rights of injured patients to obtain just compensation. I can put more in the record, but I'll just say this. Because of the impact on America's states of what they're trying to do in this bill, the bipartisan, and I repeat, bipartisan National Conference of State Legislatures has strongly opposed this bill. That bipartisan group says that after a careful review, it had reached, quote, the resounding bipartisan conclusion, their words, that federal medical malpractice legislation is unnecessary. Again, Madam Speaker, this week we celebrate the 2-year anniversary of the Affordable Care Act for what it embodies. It's about innovation. It's about not just health care in America, but a healthier America. It's about prevention, innovation. It's about customized, personalized care. It's about electronic medical records. It's about lowering cost, expanding access, and improving quality. So much misleading information is put out there about it that it's important to keep repeating the difference, the transformative nature of the legislation. In fact, it has already begun to transform the lives of America's children by saying no longer will they be denied coverage because they have a pre-existing medical condition. And soon we can fully say that no longer being a woman is a pre-existing medical condition where women are discriminated against to the tune of $1 billion a year in cost of premiums, not to mention exclusion from obtaining coverage. And so I proudly celebrate the 2-year anniversary, and I emphatically oppose the legislation on the floor. If you want to unravel Medicare, vote aye. If you want to support Medicare, if you think health care is a right for the many, not just a privilege for the few, vote no. With that, I yield back the balance of my time.
The gentlewoman yields back. Gentleman from Texas is recognized.
Mr. Chairman, I yield myself such time as I may consume.
Gentleman's recognized.
Mr. Chairman, most Americans still oppose Obamacare, yet support medical liability reform of the kind that we are considering tonight. A recent survey found that 83% of Americans believe that reforming the legal system needs to be part of any health care reform plan. As the Associated Press recently reported, most Americans want Congress to deal with malpractice lawsuits driving up the cost of medical care, says an Associated Press poll. Yet Democrats are reluctant to press forward on an issue that would upset a valuable political constituency, trial lawyers, even if President Barack Obama says he's open to changes. The AP poll found that support for limits on malpractice lawsuits cuts across political lines, with 58% of independents and 61% of Republicans in favor. Democrats were more divided, but still 47% said they favor making it harder to sue, while 37% are opposed. The survey was conducted by Stanford University with the nonprofit Robert Wood Johnson Foundation. In the poll, 59% said they thought at least half the tests doctors order are unnecessary, ordered only because of fear of lawsuits, end quote. In a poll done by the Health Coalition on Liability and Access in October 2009, 69% of Americans said they wanted medical liability reform included in health care reform legislation. 72% said that their access to quality medical care is at risk because lawsuit abuse forces good doctors out of the practice of medicine. Mr. Chairman, let's support a bill that is so strongly endorsed by the American people. Now reserve the balance of my time.
The gentleman reserves the balance of his time. The gentleman from Michigan is recognized.